Welcome, everyone. Thank you for joining us for the theoretical and empirical connections between physical and mental health among U.S. adults in a pandemic era. Before I hand it over to our presenters, I want to review some instructions for navigating and participating in this session. Audio is muted and video sharing is not available for participants. Feel free to resize or move any of the session content tools around your screen. Next, enter your questions for the presenters in the Ask Questions section, and we will share your questions as time allows. The attendee chat is also available throughout this session. If any of the tool windows disappear during the session, you may access the toolbar at the bottom of your screen to open it again. This session is being recorded, and you can watch on demand using the same link you used to sign up and join the session. I'll now turn it over to our presenters.
Thank you, Kayla, for that wonderful presentation, for the introduction. As Kayla mentioned, this is about theoretical and empirical connections between physical and mental health. And I would like to introduce myself first, and then others that are within the grant. My name is Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I've been in public health for approximately 20 years, and I am a core faculty for public health for a long time. Next, Dr. Gary Zeroni. He graduated actually from Kent State University with a doctorate in counseling. He has over 30 years of experience, and he actually did a master's internship in Seattle in private rehabilitation. And then also our research assistants that we hired, first one is Dr. Marian Jelly Sierra, and she joined Walden University School of Counseling as contributing faculty in May of 2021. And she possesses experience in teaching and mentoring. And then John Hute, he's actually one of my current doctoral students. He has had a lot of experience in geospatial, all things geospatial. So that was the group. We collaborated and we worked together. Next slide, please. So I'll hand this over to Dr. Zeroni.
Welcome. Thanks for the nice introduction, Dr. Banerjee. It's a pleasure to be here and an honor to have been a recipient of the grant and participate in this process. Very briefly, a brief overview of anxiety disorders. Anxiety disorders are not only among, but are the most common type of mental health disorders, even to this day. The prevalence, anxiety disorders affect more than 300 million people globally. There are several categories of anxiety disorders. I won't bore you to tears with all of the DSM details, but in general, may be familiar with generalized anxiety disorder. There are also social anxiety disorders, panic disorders, agoraphobias, and other types of phobias are also included. Anxiety disorders are often associated with general distress, impaired functioning, and a significant increase risk of suicide. Next slide, please. Dr. Banerjee, did you want to go over the quantitative, or would you prefer that I show this?
Sure, I'll go over this, and then we can go over the details. So this is a brief overview on the quantitative aspect of the study, and we'll take turns. Dr. Zeroni and I going through the qualitative and quantitative portion. As you know, the pandemic, the COVID-19 pandemic, has been a major public health problem. Although we think that we're out of the woods with the pandemic, Dr. Zeroni will share later how much COVID-19 is still affecting us. Of course, risk mitigation, that was a strategy that was used to prioritize and address the adverse physical health risks associated with COVID-19. One of the strategies of risk mitigation, of course, was social distancing and appropriate masking. The risk mitigation, however, created widespread loneliness and social isolation. And we're going to talk about this in subsequent slides. So this is kind of the overview. The qualitative portion, we use interpretative phenomenological analysis. So I'll hand this over to Dr. Zeroni.
Yeah, just in general, we started with a brief description of anxiety disorders, which are some of the most common mental health disorders worldwide, and certainly in this country as well. And the general idea here was that mental health disorders may well have been exacerbated by the COVID-19 pandemic. That could include additional information on depression and other mental health disorders as well. Mental health disorders have been directly correlated with poor disease management and treatment outcome. And this is the connection between medical and psychological problems in that triangle with the COVID pandemic. The purpose of the qualitative side of the study was to look at perceptions related to mental health, to physical health, to well-being among individuals, particularly African American descent in the United States. We collected data over several months and used an interpretive phenomenological analysis, an IPA methodology. Respondents discussed mental health well-being and challenges, and the idea was to essentially, through qualitative analysis, look at the qualitative aspects of the pandemic. Later on in the presentation, Dr. Banerjee will go over the quantitative side of this as well. I might add that we both, or all four of us, worked on both components of this study. Now, the respondents discussed their mental health well-being and challenges. African American individuals in particular experienced psychological distress related to the pandemic, including feelings of coercion from needing to work even when conditions were deemed unsafe, social isolation, which wasn't just feelings. As we proceed through this, I hope that we can project the idea that these psychosocial factors, biopsychosocial factors, also overlapped into medical and physiological issues. Politicization and frustration from inconsistent news, caregiver burnout of disabled children, and other such factors adversely affecting minority populations, more so, we found out empirically, than general population. Findings highlighted the impact of rapid changes and extreme uncertainty resulting from COVID-19, which, as most of us well know, kind of came on like a storm and resulted from driving individuals' fears, grief, apprehension, especially among, as I mentioned, racial minority groups. As the world transitions into a vaccination phase, which continues to this day, by the way, health practitioners will have to grapple with many additional burdens faced not only by individuals, but more by vulnerable populations. Next slide, please. The COVID pandemic is poised to remain a major public health problem, leading to considerably higher healthcare costs and many other issues. Dr. Banerjee, would you like to talk a little more about the quantitative side of the study?
Sure. Thank you, Dr. Zeroni. As Dr. Zeroni mentioned, this had a multifaceted impact on not only individuals, also in the general population, and historically marginalized populations were affected more so than the general population. Mental health disorders have been demonstrated to be directly correlated with poor disease. And this was what we were looking for. We were trying to see evidence of, I mean, everyone knows that mental health has a lot of impact. What we didn't know is that how precisely mental health impacts physical health in the context of the COVID-19 pandemic. And remember, the COVID-19 pandemic, we cannot forget about, because not only that this continues, however, we can make the argument that every 2 to 3 years, potentially there's going to be another pandemic. We must get ready for this. The purpose of the mixed method study was to explore 10-year mortality outcomes of depression. We started with kind of a baseline understanding how depression affects the total population. For that, we used the National Health and Nutrition Examination Survey as a secondary data to conduct a study. And all the individuals, like I said, was nationally representative study, 20 years and older. Next, please. So, like I was saying in the previous slide, COVID-19 was indeed a global pandemic. And as I will go through in subsequent slides, this was something we were witnessing in horror on TV as everything was unfolding. Due to the spread of mass media, we were able to see some of the real life stories of individuals that were suffering. And of course, the way this traveled was from the East, the Far East, into Europe, in Italy and some of the other places, and then onto the United States. Now, there were, I remember when we were looking at the pandemic, one of the things that was interesting and tragic at the same time was that some of the symptoms were of unknown origin were being presented actually in California. There were so many situations where no one knew what this pandemic was going to cause at that time. So, of course, that led to increased healthcare conditions, increased healthcare costs, and the loss of life. And so, of course, this disproportionately affected Black Americans. And additionally, mental health disorders have been demonstrated to be directly correlated with poor disease management and treatment outcomes. Next slide, please. All right, so I know this looks like a busy slide. There's a lot going on, and I'll defer to Dr. Zeroni as well at the end of this slide. When I know this sounds like ancient history, this is not ancient history. I mean, this just happened, and humanity has a way to forget about things that are not impacting them at the current situation. So December 2019, cluster of patients in Wuhan province presented with shortness of breath, fever, and World Health Organization informed of unknown etiology. Now remember, going to 2019, a lot of these cases were appearing. However, even the World Health Organization delayed to call this a pandemic. So there was a lot of things going on. Some of this was politicization, as Dr. Zeroni mentioned. And so all of these facets contributed to how we were dealing with the pandemic. And of course, in January 2020, Chinese authorities isolated novel coronavirus from and the World Health Organization was involved, CDC and the Federal Drug Administration. In February 2020, um, the World Health Organization comes around and actually names the COVID-19. And then Italy becomes the hotspot. And as I was telling you earlier, Italy was one of those places that was heavily affected by the pandemic. And then in March 2020, we started the shutdown to prevent the spread. And this was for non-essential workers. So if we were thinking about the essential workers in hospitals, the ICU beds were full. There was no room for elective surgery. All of these things, even to the point that we had a shortage in certain supplies, and we'll go into that a bit more later. April 2020, 68% of COVID-19 related deaths were had been affecting African Americans. May 2020, unemployment rate highest since the Great Depression. So not only was it affecting people's health, this was really affecting the economy. And so in many ways, this was hurting various countries. Of course, in August 2020, indigenous, Hispanic, ethnic minorities had the highest risk, and have been, we've been kind of reiterating this repeatedly. September 2020, tragically, the death toll surpasses 200,000. And Dr. Zeroni will give you an update of how this is going on in the current environment. October 2020, food insecurity reaches 52 million. Now, food insecurity, I wanted to take a moment to talk about this. I know this is kind of spread more, the knowledge. However, a lot of people don't know what food insecurity is about. We've conducted a lot of research previously about food insecurity, published research on this. And what I'll tell you is that not food insecurity in a mild way is disrupted eating patterns. However, in a more extreme way, this is considered a hunger, and hunger really affects people. I mean, you can't eat if you're going to sleep hungry, or if you're waking up hungry. You can't think. You can't do some of the normal things that you can when you're not hungry. December 2020, the Food and Drug Administration issues EAU for the first COVID-19 vaccine. U.S. surpasses second COVID relief act, promising $600 per person. And this is all coming out of the Centers for Disease Control. Next slide, please. Thank you. The brief history going into some of the vaccine shortages that was taking place. And trust me, we all know that that wasn't the only shortages that was there. Everything from some supplies for medications and even toilet paper was in short supply. Worldwide cases exceed 100 million, and some of the subvariants started growing, for instance, the Delta variant. In February 2021, again, there are more deaths, additional deaths that took place, and then the rates were increasing as time went along. And of course, and as early as 2021, the domestic travel limitations were lifting. And this is due to the fact that there was so much economic loss among the travel industry and the airplane industry. May 2021, the Indian variant was discovered, and then Argentina passed 3 million cases. 2021 global death toll surpasses 4 million. And so there's progressively increasing cases. And then there's growing inequality. Booster shots were recommended, executive order for inoculating Fed employees. So there were multiple places that this was affecting, and really had taken a toll on the general population. And Dr. Zeroni will talk about the JN1 strain that is currently affecting the general population. Dr. Zeroni, did you have anything to add about the COVID-19 pandemic portion?
Only that it continues to this day. Some of the more recent statistics can help to shed light on the COVID-19 pandemic and its continuation. Just very briefly, as of yesterday, I'll read the statistics here for you. There were 111,657 cases reported since 2019, as Dr. Banerjee mentioned earlier, since the very beginning of 2020 and the end of 2019. If you look at the total population of the United States as of yesterday, it was approximately 333,600,000, if I've got that right. 336,163,000. That means 1 out of 3 people in the United States alone was diagnosed with COVID. And I suspect that those numbers are conservative and underrepresented. As of the other day, nearly 110 million people have recovered, and 1,200,000 people have died as a direct result of the COVID pandemic. So that's where we are today. I might add, by the way,
I'm going to hand this off to you. Mm-hmm.
No, I was just going to say, for a brief reminder, there's some confusion in general about the names. The SARS-CoV-2 virus is the name of the virus that led to the COVID pandemic. COVID, of course, stands for the coronavirus disease, COVID. The -19 means the year that it was named. Thanks. Sorry for interrupting.
Next slide, please, and I'll hand this over to Dr. Zeroni.
Yes. Okay. So one of the idea of the qualitative side of the study, as I mentioned earlier, this is a mixed method design, was the coronavirus anxiety scale, which was used for measurement to determine levels both in the quantitative and qualitative side. Some of the questions that we asked, for example, were about in the past few days, did you feel lightheaded, faint, et cetera, et cetera? And without boring you to tears and reading the slides, this is just an example of how we set up the scale to determine levels and perceptions of anxiety. Next slide, please. We talked very briefly about anxiety early on in the presentation. And here we'll go into just a little more detail about mental health prevalence. People with mental health disorders tend to live an average of 10 years less than those without mental health disorders. I mean, think about that. Prevalence of depression in individuals worldwide is estimated to be about 350 million. And that's expected to climb. It is not decreasing. It's either holding steady or increasing over the last few years. Between 2009 and 2012, for example, depression was estimated to have affected 5% of adults 18 or older. During that same time, an estimated 28% of adults, that's more than 1 in 4, with depressive disorders went undiagnosed or untreated. In the distant past, mental health disorders were not often considered on the same level or on the same scale as medical disorders, such as heart disease or stroke, which are 2 of the leading causes of death, by the way, as an aside, sorry. Anxiety, as I mentioned early in the presentation, is the most common form of mental health disorder, okay? In recent years, due in part to some very recent government legislation, the Mental Health Parity Act has now tried to move mental health and physical health to the same levels. But as we well know, things like this can take years or even decades to equalize. So with the Mental Health Parity Act having been passed a few years ago, funding, at least for mental health and physical health, have begun to equalize. Anecdotally, and just from my memory, if I remember correctly, physical health was funded to the tune of about 90%. Mental health was at about 10%. So we've got a long way to go. It is beginning to equalize now, however. Why is this important? Next slide, please. From about 2020 onward, about March of 2020, the prevalence of anxiety and depression increased and doubled. Was this related to the COVID pandemic? On the surface, one would think, well, most likely. Well, we were curious about that. So we looked at the NHANES study that Dr. Banerjee mentioned earlier and conducted some research to determine the empirical results. There were periods when the highest rates of mental distress were reported and correlated with periods of intensifying COVID deaths and strict confinement measures. If you'll recall, there were times when people were, there were times when individuals were asked to stay indoors. And there was a lot of conflicting information about that in the news also. But as I began to mention earlier, the highest rates of mental health distress were reported correlated with periods of intensifying COVID-19 and the deaths that were increasing in a nonlinear fashion back there. I might add as a reminder for those who are interested in or knowledgeable about statistics and research, correlation is not causality. So our study proceeded. Please continue with the next slide. Thank you. Common treatment options for mental health disorders, typically more in the anxiolytic and depressive areas, include things like benzodiazepines, barbiturates, beta blockers, SSRIs, tricyclics, and some herbals, which, by the way, I might add some fairly recent information empirically has shown that some of the herbal medications that have been used to treat anxiety can also have some detrimental effects. So care must be taken in taking herbals which are not prescribed but can be taken over the counter. And I would encourage you to see someone like Dr. Banerjee, a medical doctor, to determine whether or not those herbal substances can be effective as an anti-anxiolytic. Psychotherapy interventions, which also several studies have now suggested strongly that psychotherapy combined with anti-anxiolytics can be better than anti-anxiolytics alone. But disclaimer, it depends on the individual differential diagnosis. So again, it's important to see a health care provider to determine whether a combination of CBT or DBT or mindfulness techniques can be used in conjunction with anti-anxiolytics, or perhaps tried with or without the use of medications. CBT, of course, just as a reminder to those of you who most likely already are familiar, refers to cognitive behavioral psychotherapy. And DBT, a lot of research coming out on the benefits of dialectic behavioral therapy. Next slide, please. So there was a gap in the literature that led us into this study. Which factors can impact mortality as it relates to mental health? Things like food insecurity, which Dr. Banerjee mentioned earlier, can include a lot of things and can have profound deleterious effects. Not only food insecurity, but food deserts for certain areas of population. Dr. Banerjee, would you like to talk more about the geographic aspects?
Sure. Thank you, Dr. Zeroni. So geospatially speaking, and I'm going to show you a map that we created. Geospatially speaking, as you remember, we were all staring in horror at the distribution of not only COVID-19 on the dashboards. Later on, we were looking at the rates of vaccination and some of the other things that were affecting certain regions. So there were pockets of hotspots that was affecting the population more so in certain areas than others. Um, so that was kind of the geographic distribution. Of course, we were also, and Dr. Zeroni probably could talk about this more. We were also seeing higher rates of crime because one of the reasons anecdotally was that more people were staying home. They weren't as occupied with different things. So crime rates started to increase. Of course, as both of us have been reiterating, ethnicity, marginalized populations, and individuals in minority communities were disproportionately affected. Next slide, please. All right, so the effects of COVID-19. Not only was it personally devastating, this was also economically devastating. And so we saw the airline industry starting to open up before any of the places due to the fact that they were losing a lot of money. And so this led us to a time when we were going through economic downturns that we hadn't ever seen before previously since the Great Depression. Of course, going back to history, we also know that COVID-19 was not the first pandemic. There were others, for instance, the 1918 influenza pandemic. Depression, as Dr. Zeroni was describing, is second only to back pain as a leading cause of disability. So the lifetime prevalence of 20% in adults is quite significant, and frequency under or undiagnosed. So even though I'm giving you a number of 20%, there's probably a lot more that are not diagnosed. And Dr. Zeroni, my colleague, will be going over the stigma portion of this too. So frequently untreated, dramatic shortage of mental health care providers. There was a distinction made between essential workers and non-essential workers. So even though some of the non-essential workers were staying home, these were actually affecting the economic conditions. Again, associated depression is not only greater in quantity and greater severity during the pandemic, also led to physical and mental health comorbidities. Next slide, please. So a bit more now, of course, as we know, the original strain of COVID-19 pandemic actually changed into other strains. And as you know, the current strain is JN1. So again, this was a major public health problem, leading to considerably higher healthcare costs, disproportionately affecting Black Americans and additionally mental health disorders. Next slide, please. Coronavirus, of course, affected some individuals worse, impact individuals in society. Social distancing was something that created, harmful, deleterious effects on the population. Very necessary, though, in order to prevent conditions. And of course, the stigma was something that was important. Dr. Zeroni, did you want to add a couple, anything in this slide, or should I continue?
Wouldn't mind commenting on social distancing. Just want to give a shout out to one of our illustrious graduates. And as Dr. Banerjee had mentioned in the introductions, Dr. Sierra and Dr. Huth, soon to be Dr. Huth, and a recent graduate of ours, recently published on an interesting new aspect to social anxiety. His dissertation is now out there, and an article is coming out on it. regarding anxiety stigma. Social distancing may sound like just a little minor thing on the surface. Remember, back a few years, I know how quickly I forget, we were asked to maintain at least 3 feet distance from people in stores or out in public. And then other researchers came out and said, no, it's got to be a minimum of at least 6 feet. But that social distancing to this day has had effects. Anecdotally speaking, having researched on this topic, co-presented with Dr. Banerjee in a couple of presentations and publications that we've done on this, it's still current in my mind. So as I'm out in stores and that, I still see the majority of people, not everyone, maintaining that distancing. So have the effects of the COVID pandemic driven people further apart, and will that continue to do so? I still see people wearing masks. I still see people avoiding other people in restaurants and stores and out in public. Rigorous infection disease prevention strategies may have become the new normal, is what I'm trying to say, and they may still be driving rapid changes in clinical practice. For example, just walking into any doctor's office or hospital or medical center, as I'm sure many have recently, the questions still come out. Have you experienced any respiratory problems? Are you experiencing any severe headaches or problems breathing? And I think what they're doing is still assessing for things like COVID, which, as Dr. Banerjee mentioned earlier, I'll be covering the current situation here in a few more slides. But the idea is to assess for presence of COVID since there's no longer a mask mandate. So I just wanted to add that. There is evidence that health systems concentrating on COVID-19 patients, access to care for people with mental health disorders is still limited, and the stigma still increases. And the point about stigma, as I began to mention earlier, we're seeing some research coming out now, including by one of the graduates of our own program, who's published on anxiety stigma and its deleterious effects. I'd like to reiterate also on something that Dr. Banerjee just said, and that's comorbidity, that mental health disorders, physical health disorders, and COVID-19 are inextricably linked. Next slide, please.
I want to kind of briefly mention this. I know we're getting to the end of our talk. So qualitative research is an inductive approach. Researchers collect and analyze, and then common approaches include phenomenology, ethnography, case study, action research, narrative research, and grounded theory. Next slide, please. All right, so some of the, and once we get to the findings, I'll let Dr. Zeroni talk. So the qualitative study, we looked at 326 people and thinking about these were the questions that we posed. Thinking about the current coronavirus pandemic, what, if any, what are the 3 biggest challenges and why? And then specifically thinking about the current coronavirus pandemic, what, if any, concerns do you have about the impact on your mental well-being? And what, if any, has been helping you helping your mental health well-being at this time? Next slide, please. Dr. Zeroni, did you want to?
Yes, thank you. These are some of the themes that fell out. The major themes included activities, cases, social distancing, health, and of course, distancing. Some of the subcategories that came out of this were, I believe it's on is that on the next slide? No, it wasn't. Please go back one. I'm sorry about that. Some of the most common concerns that fell out of the several hundred people of which we selected non-Hispanic Black individuals because of the disproportionate effects of pandemics like COVID-19 on certain populations, subpopulations. Some of the biggest concerns that came out were the limitations of daily activity, ADLs, as they're known in the field of rehabilitation, activities of daily living, severely limited. Physical activity was significantly limited. People weren't getting out as much. If you were a member of a gym, you weren't going there, particularly during the pandemic. As far as cases, there were serious concerns about whether there were low cases or rising cases. And this goes back to the confusion in the media at the time, the mixed messages that were out there. Fatigue was a significant concern. Getting enough sleep, the fear and anxiety that we'd mentioned earlier, talked about earlier about the connection between sleep and anxiety, social distancing, concerns about social distancing. And that also involved concerns about being with family, summer picnics that would happen all the time, holiday events where families would get together, family seeing family. There were smaller family gatherings. There was significant concern over fatigue, particularly healthcare worker fatigue. I remember seeing signs in the neighborhood on front lawns of houses that said, "Thank you to our healthcare workers for sticking through this thing." Healthcare workers were working 36-hour shifts. We couldn't get enough healthcare. As Dr. Banerjee had mentioned earlier, and I promise I'll keep this brief because we are running out of time here. Healthcare workers were working long shifts, and fatigue was just phenomenal. Having been raised in a family of healthcare workers, I saw the fatigue and the strain and the stress that was put on healthcare workers, and we evaluated these results empirically from our participants who had major concerns about being able to even access healthcare. As I mentioned, distance fatigue was another one, and of course, mental health. Next slide, please. Dr. Banerjee,
some of the quantitative results, wanted to go over that. So what we did initially was look at the general population, looked at National Health and Nutrition Examination Survey, and that was the baseline. And we decided to look in our data set that we collected between the years 2021 and 2022. And next slide, please. So this was the geospatial distribution, and geospatial distribution is very important to understand because certain pockets of the country experience this in different ways, and to understand that and to understand the balance in our sample size and in our sampling, this was important. Next slide, please. Next slide, please. So the one study that came out of this, and I'm going to be very brief on this because I think we're almost done. COVID-19 related insomnia. So what was the connection between insomnia and suicidal ideation? And so you can think of suicide ideation and the COVID-19 pandemic as twindemics. Even going into insomnia, this is another condition that took place. So one of the ways to typify this was coronasomnia. And this was a real term that was being used within the media. Next slide, please. So the meat and potatoes for this, the findings was that people that were having sleep disturbances were 4 times more likely to have suicidal ideations than the general population. And the odds ratio actually remained significant. Now, you can probably say that, this is something that is self-evident. This is, we already know this. However, in the context of the COVID-19 pandemic, we didn't know this previously. Next slide, please. This is a distribution of our respondents. Next slide, please. This is the gender distribution. Next slide, please. This is about highest education, and the distribution is representative of the sample. Next slide, please. This is the age distribution. Next slide, please. So this is an area that we really put a lot of time into, and the prevalence of anxiety. And note that this is coronavirus related anxiety. People with COVID-19 positive, they experience more anxiety than individuals that didn't have COVID-19. So this was one of the major findings. So in summary, in this study, we really had important qualitative findings and quantitative findings. This was a way to understand the pandemic in a way that hadn't been done ever before. And we were able to establish these connections between physical health and mental health. Dr. Zeroni, did you have any thoughts about this?
I just want to thank everyone involved in this study, particularly Dr. Banerjee. He and I worked mostly on the quantitative side of this. And I also want to thank John Huth for his tremendous efforts and the efforts that Dr. Mariangeli Seattle put in with helping to analyze the qualitative side. And I thank you all for being here.
Thank you for being here.
If you have questions for our presenters, although we do not have time to ask those questions, please feel free to add those in the Q&A area, and we will share them with our wonderful presenters. We want to thank you all for joining us. You may return to the Social Change Fellow Symposium event site to locate the links and to sign up and/or join other sessions. And that is right in that related content of your screen. If your schedule prevents you from attending any sessions, simply click the session link to sign up and view the recording. We hope you enjoy the symposium. Have a great one, everyone.
Thank you to our host.